My name is Katie Grogan. I'm an LPN to BSN nursing student at Indiana State University. I will be giving a presentation on neonatal abstinence syndrome for my NURS 444 Community Health Nursing course. The learning objectives are as follows. Identify the population at risk. Define neonatal abstinence syndrome. Recognize early signs of NAS. List symptoms associated with NAS. Determine nursing interventions needed when providing care for neonates. Identify short and long-term effects of NAS. Know resources available, and successfully take the pre and post exam. Here's a pre-test for this presentation. It consists of 10 questions. All of the answers will be covered in the post-test question part of this presentation. This pre-test can also be found in a PDF document that is linked here. We will go over the questions throughout the presentation. Question 1 reads, in the United States, how many newborns are diagnosed with NAS each day? According to the American Academy of Pediatrics, neonatal abstinence syndrome, referred to as NAS, is a result of the sudden discontinuation of which of the following? Question number 3. What is the name of the scoring scale used to assist in the diagnosis of NAS? Question 4. Which of the following assist in the diagnosis of NAS? There are multiple answers for this question. Please select which ones apply. Question number 5. What is the most commonly used drug in the treatment of NAS? Question number 6. What is the effect of transmission across the placenta in relation to the neonate's gestational age? Question 7. What is responsible for most signs that are seen in a neonate with NAS? Question number 8. What neurotransmitter is the result of sleep disturbances in neonates with NAS? Question 9. Which of the following are the most common presenting signs of NAS? There are multiple answers here. Please select all that apply. Question number 10. The final question on the pre and post-test exam reads as follows. Which non-pharmacological interventions are necessary in the treatment of a neonate with NAS? There are multiple answers. Please select all that apply. All of the information within this presentation is credited to the American Academy of Pediatrics. We begin with the population at risk. Neonates, defined as newborns until they reach 28 days old. Vulnerable, weak, sensitive, overwhelmed, helpless, needy, small. These are just some of the words that are associated with a baby undergoing neonatal abstinence syndrome, which is defined as a result of the sudden discontinuation of fetal exposure to substances that were used or abused by the mother during pregnancy. The crying heard here is an infant born addicted and diagnosed with NAS. The screeching, inconsolable cry is a classic sign of a baby with NAS. They are screeching, hurting in pain from the withdrawal symptoms. It is a horrible sound to hear. They're also seen jittering, excessive tremors, hyperirritability, agitation, and diarrhea. All of these signs are clinical signs seen within 24 to 48 hours. Symptoms associated with NAS. Temperature instability, they usually run a fever. There's sweating, sneezing, mottling, they're tachypneic. There's nasal flaring, which sometimes causes a misdiagnosis because of the respiratory distress they are in. Gastrointestinal is severely affected, including poor feeding, regurgitation, vomiting, diarrhea, and poor weight gain. The first request to know what the baby was exposed to is the mother's self-report, in addition to analysis of the urine and meconium for toxicological confirmation. An immunoassay technique is used in hospital laboratories. Nursing interventions. The Finnegan scoring system is used to quantify the baby's withdrawing status. Non-pharmacological measures include feeding the baby, high-calorie formula, swaddling, promoting a low simulated environment, low noises, dim light, really comforting that baby when they need it. Pharmacological measures. The first drug of choice used to treat an NAS baby is morphine. It is given every 3 to 4 hours, and when not successful, the secondary choice is methadone, which has a better half-life, lasting 12 hours, so the drug only needs to be given twice a day to the baby, but it does prolong their hospital stay. The most common short-term effects seen in an infant with NAS are motor deficits, cognitive delays, relative microcephaly, and failure to thrive. The long-term effects are hyperactivity and impulsivity, attention deficit, school absences and school failure, behavioral problems in school-age children, ophthalmological problems, so there's usually refractive errors and visual deficits, and short stature, again related to their failure to thrive, and growth delays. $30,000. Take a minute to let that number sink in. That is the amount of babies born in the United States with NAS every year, and with the opioid crisis continue to rise, that number will rise as well. Here's a list of just some of the plethora of resources available for both mothers and infants who may be or who have already been diagnosed with NAS. Early identifying of prenatal opioid exposure is key to sustaining the mother-baby dyad. Consider that just 1 in 5 infants are exposed to opioids prenatally. Early screening is so important. When fulfilling a community health nursing role, we must support the substance abuse community. We must approach mothers in an empathetic, caring manner and help them seek the treatment they need to prevent the continuous rise of the opioid crisis and the negative effects associated with NAS. At this time, please take your post-test and we will be reviewing the answers to each question. Number 1, D, 80. Number 2, B, fetal exposure to illicit substances. Number 3, A, the Finnegan Neonatal Abstinence Scoring System. Question 4, A, meconium, and B, urine. Question 5, C, morphine. A, increases as gestation increases. Question 7, B, an increase of opiates causes decreased production of norepinephrine. Question 8, C, decreases of serotonin. Question 9. A. Tremors and irritability. B. Excessive crying. And C. Diarrhea. Question 10. All of the above. A. Swaddling. B. Dim light and low noises. C. Avoidance of wakening during sleep. And D. Gentle handling.